sometimes modification of shoes. For most sports injuries, will at least give some people a little bit of improvement. And if those things don't work, definitely
a lot of it are Achilles tendon issues, and we're going to put up a little graphic to show
Sure.
people where this is on the leg.
The Achilles tendon is one of the largest tendons in the lower leg. It attaches from the calf muscles all the way down into the back of the heel bone. And very, very common to have an injury of the Achilles. Sometimes it can be outwardly swollen. This is a tendon that you don't really want to mess with. So you really want to get in to see somebody ASAP when your Achilles starts giving you some trouble. If you're not getting relief with your simple stretching and icing and such, please get in to see somebody sooner than later with an Achilles problem, because there can definitely be some
Leads to this kind of injury more so than others.
Very often when somebody's foot is very collapsed and what we call pronated, or the arch rolls in, very often that may be a predisposing factor for an Achilles issue. A lot of times if patients have very tight calf musculature, some of this as well. So.
And this is a slow healing sort of injury, isn't it? It takes a long time to heal.
Yeah, quite often tendons are a little tricky to heal. Once you let them go too long, it sometimes takes a little bit longer to get the tendon back on course again. And there are occasions where it may never be perfect again. So it's definitely something. So.
And what percentage of cases in your experience have had to go to surgery, for instance?
Well, I'm a little more conservative in my practice, but certainly there are times where surgery might be appropriate if there's a tear in the tendon.
Mm-hmm.
There are some new procedures out on the market that are less. Great.
Go ahead. You have a question for Dr.
How are you
Shaney?
both today?
Pardon?
Good. Thank you very much.
Good. Dr. Lisa, I've been to several podiatrists, and they have all given me different diagnoses. I have problems between both small toes. It's like a fungus, and they she informed me that I should keep it dry between the toes, because the fungus comes from moisture and what have you. So when I come out of the shower. But anyway, I've had this problem for about 4 years.
Mm-hmm.
And I've been to some of our so-called top podiatrists here in Chicago. Anything that could cause that particular problem?
Well, obviously it's hard to diagnose over the phone, but it sounds like, if you've been to quite a few podiatrists, it sounds like if they're thinking that there's a little athlete's foot or skin fungus in between those two toes, you have to make sure all the medicines in the world may not help if you don't keep your feet type sock. If the best way that you can determine the kind of sock is maybe to look at the running socks that are out on the market and look at the materials in there. There's usually a little bit less than 20% cotton in those kind of socks. So keeping your foot super dry is important. Sometimes we have different kinds of powder. Longer antiperspirants for your feet and hands on the market as well. So really keeping your foot as dry as possible. If you're a sandal person, go ahead and maybe wear sandals in the summertime to keep that little bit more air in that area. And generally, one other thing that's a little bit old-fashioned but works very well is a little bit of lamb's wool, the old-fashioned lamb's wool. as well. So
Oh, wonderful.
Yeah.
Thank you so very much.
you're very welcome.
Okay.
Thanks for calling.
So we're done with the Achilles tendon. So let's move on to talking about shoes, because shoes are something that are very important to any athlete.
Yes, yes.
And there's a lot of marketing encouraging people to buy certain kinds of shoes versus others. Necessarily be the right shoe for your kind of activity. So let's start with the basics. When someone's at the beginning of purchasing a shoe, what kinds of things should they look for that are going to match their shoe with the kind of activity that they're undergoing?
Well, shoes are one of my favorite subjects. Athletic shoes should, to the best of your ability, walk. You can certainly wear a good running shoe, and it's very important to make sure that when you are first starting a program, it might not be a bad idea to actually go into a store that will actually properly fit you, measure your feet. Most of us don't get our feet measured, and we don't realize that our feet are much bigger than they used to be. So making sure you're in the right
Question here. Go ahead, caller.
Oh, hi.
Hi.
Hello.
Yes, I'm having a problem with gout,
Okay.
and I wanted to know what can I do to help prevent it besides the medications that I'm taking?
Well, gout is a condition that and it is kind of considered in the arthritic category because when you have increased uric acid that is in your system, either from the foods that you're eating, or if your kidneys are not flushing out the uric acid from the food that you're eating properly, what can happen is that acid can build, that uric acid chemical can build up in the system. And the big toe especially. And it is kind of considered in the arthritic category because what it does to the joint. It causes a lot of damage into the joint, and people can have a lot of inflammation. It may come and go in 3 or 4 days. But there are certain foods that you want to watch in your diet, red meats, even you want to make sure that your medical doctor has checked you with your kidney function and make sure your kidneys are functioning properly. And there are some simple remedies. Sometimes they'll talk about cherry juice. There's at some of the health food stores, they have cherry extract and juices, and they have capsules, and it's usually very safe for most people to watch your diet.
Okay, thanks for the call.
Thank you.
I think we have another caller.
Great.
Go ahead, caller.
Yes, I'm a runner. I have a small neuroma between the second and third metatarsals. Have had one steroid shot in that location, no relief, and just curious about the possibility or probability
is an injury where the nerve that comes between the metatarsals that splits and goes into the toes becomes squeezed and pinched. And quite often neuritis or neuromas are caused by improper foot mechanics, and if the foot is collapsing or rolling in, that can cause it. Certainly if a shoe is too narrow or too tight, that typically